Good evening, and thank you for joining us for Conversations Live Diabetes Prevention. I'm Patty Satalia. Nearly 17 million Americans are living with type 2 diabetes, and many don't even know they have it. Tonight, our panel of experts will explain why early diagnosis is critical in the successful treatment and prevention of serious, sometimes life-threatening complications associated with diabetes. They'll also answer your questions. Our toll-free number is 1-800-543-8242. If you prefer to email your question or comment, our address is connect@psu.org, or you may tweet questions to @WPSUConnect. Now let's meet our guests. Susan Trainer is a certified registered nurse practitioner and diabetes educator with Mount Nittany Physician Group in State College. She's also the president of People Centered on Diabetes, a community organization formed to help improve the lives of those currently living with diabetes and to raise awareness for those at risk of developing the disease. Diana Berland is a clinical dietitian and certified diabetes educator in the endocrinology department of Mount Nittany Physician Group. And Lydia Abdullah is living with type 2 diabetes. She's also a board member of People Centered on Diabetes and has been successful in advocating for diabetes awareness and screenings. Thank you all so much for joining us.
Thank you for having us.
Despite medical technology, Americans are less well today than ever, and by almost every measure, which is frightening. You coined a phrase, diabetes tsunami, to explain the situation. What's happening to us?
Well, diabetes, it's exploding. A couple of years ago when I was working in my office, I realized that we had more people asking for our help than we could fit in at any given time. And I thought at the time that it might have been related to a situation, and it occurred to me at that moment that this wasn't a situation anymore, that what we were seeing was just the tip of a wave that was coming. And what we're seeing now is the beginning of that wave coming. And diabetes, as I said, is really, it's starting to explode all around us. 1 in 3 children born in 2000 will have diabetes in their lifetime. That is absolutely astounding.
We're going to be focusing our attention tonight on type 2 diabetes and in particular managing and preventing type 2 diabetes. So before we go any farther, some definitions might be useful. When we refer to type 2 diabetes, we used to say adult onset. That word doesn't even work anymore. But explain the difference, if you would, Diana, between type 2 diabetes and type 1.
Type 2 diabetes based on condition called insulin resistance. That's when our bodies cannot process insulin, cannot process blood sugar correctly. Type 1 diabetes based on insulin deficiency first. So there's a big difference between those two. And yes, Patty, you're absolutely right. Now, more and more, unfortunately, we diagnose children with type 2 diabetes.
And Lydia, you were diagnosed with diabetes 10 years ago. You were someone who had a family history of diabetes, so you actively checked year after year and were fine for years and years. Then one thing happens, and suddenly, like millions of other people around the country, you have diabetes. You're there. Tell us a little about what happened.
Well, I tell you, it was hard for me to accept that at first because I was very diligent about checking each year. My mother had diabetes. I had a sister with diabetes and a cousin. So I was very good about making sure that, you know, we checked whenever I have a physical. And it really took one event to trigger things. The only form of exercise I did was walking on a treadmill. Fell off my treadmill, hurt my Achilles, was not active for several months as it healed, put on weight, and it just tripped it. It just tripped it. And unfortunately, I wasn't aware of what was going on. And it took an illness to reveal that my numbers were out of control.
And you've since managed it. Tell us a little bit about what you've done since getting that diagnosis.
Well, I tell you what was the greatest thing is that the diabetes educators were right there and ready. So they taught you not only about how to eat properly, but also about all the medications and what was available. And the hospital had a support system as well. So it was a matter of getting on the right medications, figuring out what would work for me, changing some things in my lifestyle, and trying my best to stick to it. Yeah.
The interesting thing about Lydia's story is that it was a small change that tipped the scale. Yeah. But the best news about that is sometimes it's a small change that can push you back over to the other side.
Absolutely. Small changes that are sustainable, things that you can do starting now and that you can do every day going forward. Those are the kinds of changes that make a big difference over time.
And I think the important thing, and we're going to take a phone call in just a moment, but I think the important thing is to set goals, and you can speak to this, goals, Lydia, that are manageable. And it's interesting because if there are 5 goals and you only attack one of them, there's going to be
absolutely and
some results.
Yes, and I think what is very, very important is to set goals that are manageable for you.
Yes.
Not what you have to do, not what you can do at the end, but goals that will put step by step you towards your target, towards your main goal.
Before I take that call, I have to ask Lydia one more thing. And I was reading on your website, People Centered on Diabetes, which is terrific, a terrific resource of all kinds of information. I think what I like most about it is that people who have some role, either they're diabetic, they're part of the board as you are, Lydia, they're health professionals, they've written articles that really speak to people who are dealing with this issue. But one of them was written by someone named Paula Ray, who wrote something titled Diabetes Guilt. And she writes, how did this disease hit me? And she said, with tremendous guilt and shame. And I'm wondering, can you identify with what she was saying?
I think there's such a social stigma attached to dealing with the disease, and you will also personally internalize, oh, it's my fault. If I had never allowed this to happen in my life, then it wouldn't be this. And, you know, society looks at you often as you failed. You know, somewhere in your life you didn't do the right thing, and now look at the result, whether it is just a matter of being obese or failing to exercise or people not taking their medicine. So there is that sense of guilt and shame, and unfortunately that's driven a lot of people in the closet, and they're not dealing with it at all.
So it's counterproductive.
If I may just expand a little bit on that, oftentimes we talk about lifestyle. Lifestyle leads to obesity, lifestyle leads to diabetes, but we have to remember that beyond lifestyle there are some factors that we cannot simply control. It's our family predisposition, our genetics, our age, our ethnicity, something that we cannot control and we cannot be blamed for. And so forth.
But I love the saying, genes load the gun and the environment pulls the trigger.
That's right.
Exactly.
That's right.
Yeah. That really speaks volumes. Let's go to our first caller. We have Gail on the line. She's calling us from Lycoming County. You're on the air, Gail.
Yeah, I'd like to ask if she thinks the reversal surgery for diabetes will work for my daughter.
When you say reversal surgery, do you mean bypass, gastric bypass surgery?
Yes, I do mean the bypass. I mean that exactly, because she has to take Actose, and she takes metformin, and it costs $400 a month, and it's expensive. And if there's a cure, I'm sure that she now has insurance. So I want to know if this hair surgery is permanent.
Well,
it's forever.
Unfortunately, there's not a physician on the panel, but you've certainly worked with patients who've had gastric bypass.
Yeah, and thanks for the question, Gail. With gastric bypass, people who typically have the procedure can go on after the procedure to have normal blood sugars without medications. We wouldn't call that a cure, but diabetes at that point is controlled. So in your daughter's case...
She was diabetic until she became pregnant. And they said it would go, and it never did, and he's almost 13. So
I see.
I just want to know what you thought, and I appreciate your honesty and everything.
Of course, a physician would have to answer that, but the interesting thing about gastric bypass surgery is that sometimes the lead up to the surgery, the lifestyle changes that people have made, get their blood sugar levels where they need to be before the surgery.
But, you know, Patty, I think we need to go back to the whole issue of lifestyle. My sister had the surgery done and was not willing to change her lifestyle afterwards. The surgery does not do it.
You have to still do it.
It is a tool and a mechanism, but if you fail to follow through on what's needed, you've wasted money
Which is the reason there's a lot of psychological testing before.
Supposed to be done. Yes.
From my point, I always like to reserve surgery as a last resort.
Absolutely.
As a last resort. If you tried everything and you just could not reach, your goal, then yes.
And actually, I just heard an interesting study that showed that people who were enrolled in the gastric bypass surgery programs lost about 10% of their weight before the surgery, but family members actually lost weight during the process in the lead-up. So the behavior is actually socially contagious. So there's a lot of support around that.
Well, that brings me back to Lydia, because a lot of families say, as part of supporting a family member who has diabetes, it's improved their health. Can you say the same thing in your household?
I think it's a matter of they have definitely become educated, because, you're going to let your family members know what you need to do to sustain life and have a productive life. So naturally, what's in the cabinet and refrigerator changes. So their selections change. I personally like to keep family, close friends, coworkers well aware of my situation, so that they're there to help and support and assist. So, you have coworkers knowing to bring in, instead of the cake for the birthday, fruit. So you do become contagious in that sense. People make some changes based on what you need to do to survive.
And you might change the environment at work. Some people think, oh, this is wonderful. They're bringing in the candy dish for everyone to share. And I have to say, I have a hard time keeping my hands out of it.
That's exactly right. That's exactly right.
But if you
plate
keep
of vegetables or fruit, that's something that's a healthier choice for you, and that's something that's good for everybody.
And I think they're realizing, okay, here's an option not just for me, and not just for Lydia, but it works for the rest of us. So I think family, friends, and your coworkers do change.
So the support network makes a big difference.
Sometimes it just takes one person to start a new tradition in your office and do something different.
Well, and Lydia's mentioned the three-legged stool, managing diabetes with medication, diet, and exercise. And we were talking about this before the show. That should actually be four legs, and there should be social support around managing your diabetes, having help from family and friends, changing the environment at work, at home.
And you say, actually, Susan, what's needed here is a policy change and an education change so that we are combating type 2 diabetes the way we addressed smoking.
Yes.
That's a good point.
We've talked about that a lot. It's not just change on an individual level, it's social change.
Yes.
So I see patients in the office, we talk a lot about behavior and things that they want to do to improve their health, and they're very committed when they leave the office. But then they leave the office and they're confronted with all kinds of things. They go to buy gas and they're confronted with food choices they never had back in the 60s and 70s. So it's a different environment than it was. And just like smoking was an accepted part of the environment we all lived in, we're looking at changing the environment around us so that people can make those changes and live with them outside the office.
And Lydia brought something up that I think is important, and that's what's in the cupboards. So let's talk a little bit, Diana, about some really healthful changes, and perhaps tell us a little bit about the glycemic index, looking at nutrition labels, and how to figure out, in fact, many would say there should be few things that you eat that come in a box or in a can. Shop the outside aisle.
Exactly. That's what I like to mention to my patients. First of all, never go shopping hungry. Because then you will buy half of the store and you'll do the good business for the store, but not for yourself. And then, of course, start shopping, going around produce section, then move to your meat section, then go to your dairy section. And only if you need something from processed food from inside aisles, then you go there and just pick up a few items if you need them.
Mike Pollan said something that I love. If it was grown in a plant and not made in a plant, you should eat it.
Exactly, exactly.
This is such a beautiful theory. And it works for, I think, a large portion of our population, but an area that it doesn't work. If you look at our cities that don't have a grocery store that's laid out strategically like this, and you have populations of people who all they have is perhaps that corner store or that
No access to
convenience
produce.
store. Yeah.
Right.
No fresh produce, no fresh vegetables, nothing. And if they do find it, the price is outrageous. You know, so as a result, you do see amongst underrepresented people is an increase in the numbers of people who fight diabetes.
This is part of the reason you've been so vocal about your own diabetes.
Yeah. It's critical to understand that we are impacted more. Hispanics are, Native Americans, African Americans, our percentages are higher. And, you know, but yet we don't necessarily have, some of us do not have readily available this wonderful program. Oh, I go to a nice grocery store and I can shop the outer aisles. It's not always there.
Excellent point.
So it kind of tumbles.
Now, you brought in some portion sizes because I think that's something that people are always wondering about. What is a reasonable portion size if you're dealing with diabetes, or if you're trying to prevent type 2 diabetes?
You know, it is very challenging because you try to control your portions and you don't know where to start, and you don't know, should I count calories, should I count carbohydrates, how do I do both at the same time? I actually like to refer patients to simple plate method. And so if you can see, the plate divided into 3 parts. The largest part is devoted to your vegetables, non-starchy vegetables, your fiber. Yeah, right. And then you divide another half into half, and you have quarter of your plate for your meat and quarter of your plate for your starch. What it boils down to, basically, the portion size of 3 ounces. 3 ounces of chicken, 3 to 4 ounces of fish, and it looks like that. And basically, if you don't have measurements, if you don't know how to estimate, I brought with me today simple deck of cards.
A visual here.
I mean, exactly, deck of cards. And what I encourage my patients to do is basically pull out a deck of cards that we probably have in our houses anyways, somewhere. Put it on your kitchen counter. And whenever you're serving yourself, just look at your deck of cards and compare the portion. Same goes to portioning your starch. If you are serving yourself, instead of just pick up, you know, fork and your tablespoon, put your measuring cup on your kitchen counter and serve yourself using your measuring cup. This way you don't do double job. You just simply using this tool.
A couple of other good tips may be use a smaller plate, and don't eat your dinner in front of the television set. Why it causes us to eat more, I don't know. Maybe it's because of the commercials we're watching. But
actually, no, good point about commercials. You know what I always advise my patients to do? Is to exercise during commercials.
Get up and
You're
move.
watching TV, you have 2 minutes commercials. Get up. Do something.
Get away from the TV.
even at work, I was reading, in preparing for tonight's program, I was reading that even fidgeting at your desk, making your,
Some movement.
bouncing your foot up and down can have an impact, and especially if we're talking about if you're a 150-pound woman, you need to cut 500 calories per day to drop a pound a week, 10 pounds in 5 weeks. How do you get 500 calories out a day? But as you said, maybe moving at your desk is part of that.
Yes, moving at your desk, cutting back on portions, using smaller plates, something like that.
But I think the moving is really important. One of the things that we recommend for our patients is getting a pedometer. Counting your steps, 10,000 steps a day. That's about 5 miles a day for the average walker. So starting out with a baseline, looking at how many steps do you have, and trying to increase that by 500 steps every week until you're at 10,000 steps. So it's important to watch what you're eating, but it's really important to make sure that you're moving. Moving is key.
And you know what is very important to remember, that you don't have to run a marathon tomorrow.
Right.
No.
Right.
I had a patient the other day who lost almost 100 pounds in 10 years. And when I asked her how she did this, she said, well, I was watching TV, I started moving my legs and arms. I was waking up every morning, I moved my legs. And slowly, gradually,
you can move.
Move what you can move.
That's true.
And slowly and gradually, she started walking outside. and she's 100 pounds lighter 10 years later.
We saw a wonderful woman just a few weeks ago, a patient. She's a working mother. She's home with her son in the evenings. She had every reason not to exercise. She's tired when she gets home from work. She doesn't have a treadmill. She can't take her son outside. The weather is bad. She decided to walk up and down the stairs in her house. She's made a habit of that. And she's lost 7 pounds in about 4 weeks, walking up and down those stairs every night, 20 and 30 times, adding an extra set of stairs. So just working with what she has in her house, she's managed to lose 7 pounds. It's fabulous.
And I think going back to the whole issue of that personal goal, you know, it could be intimidating to think, oh, I got to do 10,000 steps. And you look at your pedometer and maybe you did 500.
Right.
It's easy to plop that thing in a box and keep on moving. But if you have the right people saying to you, you know, you did 500 today. Wow. Keep working towards 500 and then set that goal a little higher, you know, and not jump to what we see as these ultimate end goals, you know.
Right, and walk 510 next week.
Exactly.
And do it because you can.
You can. Right.
We talked earlier about reducing stress in your life because you talked about the fact that you manage your diabetes very well, but all it takes is a stressor, which could be an illness or too much piling up at work, whatever, to make the numbers not look so good.
The whole issue of stress, I think, has been underrated. It'd be very interesting what they have to share. But from someone who is fighting the disease, it was so important to learn that stress will just do you in. And the chemical part, they can explain to you. But I know for a fact.
You feel it.
Yes, and family sees it.
Right.
You know, whether it's a physical stressor of fighting a common cold to stress at work simply because you have a deadline, it impacts that glucose level so much.
It absolutely
And
does.
if you are not in tune or aware that, you know, Patty shouted at me today, that's what drove up my glucose, and learning how to manage that.
And learning how to set boundaries and take care of yourself. That's really important.
So it's get active and get relaxed.
Yeah.
At the same time.
But you know, activity can relax you.
Well, that's true.
I think that's really important.
You have to
I think
find what it
activity
is.
has gotten a bad name. People think it has to look like something huge, and it really doesn't.
Right.
If you're just joining us, I'm Patty Satalia, and this is Conversations Live Diabetes Prevention on WPSU TV. Let me reintroduce our guests. Susan Trainer is a certified registered nurse practitioner, a diabetes educator, and president of the community organization People Centered on Diabetes. Diana Berland is a clinical dietitian and certified diabetes educator. And Lydia Abdullah is living with type 2 diabetes. She's also a board member of People Centered on Diabetes. Our telephone number is 1-800-543-8242. And our panelists are ready to take your call, beginning with Dick, who is calling us from Johnstown. Go ahead, please, Dick.
Thank you. We're hearing so much about white flour and breads, even whole wheat. You hear so much about whole wheat bread and multigrain breads. They all apparently contain flour. And I was wondering, obviously it's a carbohydrate, but apparently it raises your blood sugar more significantly, I believe, than people realize. And I was wondering what your comments might be on flour in a diabetic diet or a pre-diabetic diet. Thank you very much.
Thank you for your call. Diana?
Sure. Yes, you are absolutely right. Any flour will raise your blood sugar because
it converts to sugar.
It converts to sugar. It is carbohydrate. It's going to be digested into sugar. Now, the important part to remember, for your health, it is better to eat a whole product. It is better to eat a whole grain product than white product because it contains some fiber. It contains important vitamins and minerals. It will be digested slower in your system, so it won't spike your blood sugars as much. But still, if something is good for you, it doesn't mean it is good for you in large amounts.
Right.
Portion control is crucial. And what I like to tell my patients, you still have to control the amount of carbohydrates. So if on this hand you have white flour and on that hand you have whole grain, whole wheat, eat whole grain, but eat the same amount. small
Don't eat
amount.
2 pieces.
Don't eat
Right.
2 pieces. Don't eat 2 pieces. The best product for you can still elevate your blood sugar.
Now, the difference between eating white bread and pumpernickel is amazing. I mean, the difference between white and whole wheat is significant, but you take white versus pumpernickel, and wow, it's going to
yes,
much slower conversion.
Much slower conversion. But also we have to remember that when we are eating pumpernickel, when we're eating whole grain, calorie is a calorie. So we still have to remember, I always emphasize portion, portion, portion.
Diana, how important is protein in a diet for someone with diabetic or pre-diabetes? And we'll probably need to talk about what pre-diabetes means, but...
Yeah, well, we have a couple of food groups to basically to play with when we eat. We have proteins, we have carbohydrates, fats, non-starchy vegetables, so forth. So with diabetes, we are trying to control amount of carbohydrate because they're going to be converted into sugar. So what is left on our plate that we can eat without worrying too much about raising blood sugars? We have non-starchy vegetables and we have protein. So protein is a part of a diet that, besides, of course, qualities of protein that we all need, but it helps to fill the plate and not feel hungry, because protein tends to stay in our stomach much longer, so people don't feel as hungry.
And you're not going to get that spike.
You're not going to get that spike, exactly, and you're not going to feel hungry, and you're still going to, you'll be able to control the amount of carbohydrate.
And how important is that first meal of the day? Because it's something that lots of people skip.
You know, it is very important for a couple of reasons. First of all, if you don't eat for an extended period of time, which means from your evening till, say, you skip your breakfast, you eat your lunch, your body turns into starvation mode and your metabolic rate slows down. So what happens when you eat your second meal, you're not going to burn it as efficient. And besides, you're going to be hungrier because you accumulate this hunger. But what I try to tell patients that your first meal doesn't actually have to be extremely large. A lot of times people wake up and they say, well, I'm not hungry at all. I cannot eat. So I try to say, okay, can you eat just the yogurt, just a little bit, just something. Just let your body know that food is coming. Keep moving, keep burning. Yeah, so it is important to eat something, but it does not have to be an extremely large meal.
You know, Patty, before you move on to the definitions, I wanted to go back to an issue about the carbohydrates. We're again back into a cultural, social issue. When you think about family gatherings, you know, it's the meat and the potatoes, you know, the cheese and macaroni, the big pasta dish. You know?
And how we grew up influences this so much.
That was comfort food. So, you know, you're relearning for yourself, but you're also making everybody else learn what is going to be good for you and everyone else. And to tear that part of your culture away takes a lot of extra effort as well. It's not just me trying to figure out what's appropriate, but what goes with it. There's a pain that goes with it.
Right. And this was what my grandmother made for me. But I also think things happen when you eat comfort foods. They're feel-good foods. People don't reach for, say, steamed broccoli and chicken breast when they're going through a hard time.
They
want the macaroni and cheese. They want the Ben and Jerry's.
But as you said, just don't eat a whole lot of it.
Comfort yourself with a little.
So there's a lot of
little comfort.
that. There's a lot of, there's the cultural pull, the social pull, but there's also the feel-good pull.
Right.
Well, let's talk a little bit about pre-diabetes, because some people act like it's no big deal.
Right.
It's a very big deal.
It is. It is. Pre-diabetes is a condition before diabetes. Diabetes is diagnosed based on blood sugars, and a diabetic diagnosis is having blood sugars of 126 or more on 2 separate days. Pre-diabetes is that period of time when blood sugars are abnormal, but they're not high enough for diabetes diagnosis.
This is your warning call.
Right. And you know, this is really an important time. This is a really critical place. 1 in 3 adults in America has pre-diabetes now. So people don't feel sick. They don't know they have it. And this is the time when lifestyle changes make an enormous difference. Getting more active, watching your diet. These are the kinds of things that can actually prevent the progression to diabetes or delay the progression to diabetes. And so it's really important that people start becoming more aware of these numbers, knowing what their numbers are, taking diabetes, pre-diabetes risk assessment tests like the American Diabetes Association tests.
These are online.
These are online.
Yes.
So really, if you don't know what the numbers are, if you can't memorize them, if you don't know them off your tongue like I do, it's still worth asking your primary care provider, your physician. What are my numbers?
I'm going to take a phone call in 1 minute, but we're so concerned about blood pressure, cholesterol, and blood sugar level, but I've read that you should be equally concerned about insulin level. And no one tests for that I'm aware of.
Right. And this is particularly important in pre-diabetes. In type 2 diabetes, you can actually have higher than normal circulating levels of insulin, and that can cause problems too. And we don't test for circulating levels of insulin. We look at blood sugars. But that's all part of type 2 diabetes, pre-diabetes.
Okay, I want to come back. When we come back after this phone call, I want to talk a little bit about testing, when, how often, and that sort of thing. But Teresa is hanging on. She's calling us from Crescent. Go ahead, please, Teresa, I'm sorry.
That's okay. Thank you for taking my call. My concern is this. I know many people who are diabetic that are on beta blockers, and they seem to have gotten the diabetes shortly after starting taking beta blockers. And I'm concerned about diabetes that is caused by prescription drugs.
Well,
Is that something you may know something about?
Well, one of the things that I've seen a lot are, say, for example, people who start insulin who develop problems with diabetes shortly after they start insulin. And often these problems are caused not by the medication that's been started, but by the fact that it was started at a point in their disease when they were beginning to develop problems. So I don't have any information, say, on beta blockers causing a problem like that. We'd be happy to get more information for you if you'd like to leave your email address or phone number.
But the interesting thing about what she's saying is the same things that cause heart disease cause diabetes. So it may be that no one knew you had this underlying problem.
Right.
And it's a question of which came first.
Right. And people typically don't feel sick with pre-diabetes or diabetes. And I think most people think that when they have a disease condition, they should feel sick. And that's what's different about diabetes. They don't feel sick. So they don't know what's happening until it's there.
But she raises another interesting point, and that is that some say that the best medicine is food. What you put on the end of your fork is more important, and you can get more benefit than you can from what's in a pill bottle.
I think it depends on the stage of your disease, of course, and as a prevention, yes, absolutely. As when you have diabetes, yes, absolutely, you need good diet, you need exercise. But sometimes diabetes reaches the point where diet alone, exercise alone just cannot do it anymore, because pancreas can exhaust itself and just not capable of compensating. So then you need help.
And that's that three-legged stool analogy. That's the nutrition, the diet, the exercise, and also medication. So.
And here's where I think education is very critical, not only for the person fighting the disease, but for society. Our support system helped us very much with dealing with taking medication is not failure. The world will tell you, oh, you have to take pills. Oh, you mean you have to take insulin? And you can, again, develop this whole sense of, oh, I'm failing again. And we've had good people sharing consistently. That does not represent failure.
Right.
You know, is this a part of what you need to do to stay alive?
Diabetes is a progressive disease, which means that it will progress. You can slow it down, you can stall it, but it might progress. It's not
despite doing everything.
Despite doing everything, exactly.
And that's where again the
disease process itself is progressive, and many people who have type 2 diabetes will wind up on insulin at some point in their disease process. That's not a failure. That's part of their treatment plan. That's part of the approach.
Okay, good point. Kim is calling us from Sykesville. Go ahead, please, Kim.
Yes, ladies. I think your panel is very informative, and I appreciate you being on the air tonight.
Thank you.
Diabetes runs rampant in my family. My grandmother and my paternal aunt both were blind from the disease due to detached retinas. And I know I have an X on my head genetically to get the disease. I'm 55 years old, and That's about the age my father got type 2 diabetes. I gave up sugar because I was addicted to sugar in December of 2010, and I found it to be life-changing. I'm making a dramatic effort to prevent from getting the disease, and I try to exercise, and I eat. Well, I've been a vegetarian since I was 15, so I eat a lot of fruits and vegetables.
We're impressed.
You're doing an awful lot to help yourself.
I'm not calling for flattery. I'm just mainly saying, despite trying to do everything right, do I still, am I still so predisposed genetically to get it? And if so,